Dr. John Stephen, you've long been a GP in this country, now retired. Death is a bit of a taboo subject in this country, isn't it? And do you think people spend enough time thinking about death, preparing for it?
The quick answer is obviously no, we don't. And I think the reasons are fairly simple, actually, because if you think of the way society is organised today, it's a largely urban society. I think many of us reach the age of 50 or 60 before we've ever seen a dead body. It is a taboo subject. And obviously, we need to do something about this.
According to the NHS, more and more people are expected in future to die at home. And I'm just wondering what effect you think these changes are going to have on the family practitioner.
My first reaction was when you used the word expected, and that just amazed me that the Department of Health were expecting this. I absolutely accept that patients hope and want to die at home, and I would do everything in my power to support this in every way that one could. For it to happen, it would need absolutely enormous changes in the way general practice is organised at the moment. The very new GP contract would have to be reconsidered. I think I can best show what I mean by talking about a personal matter. My wife died some years ago of a cancer of the pancreas. She and I were both united in the hope that she would die at home. She very, very much wanted that, and I did too. Now, if her doctor had opted out of out-of-hours work, all weekend work, and was working part-time as well, there is no way that she could have died at home. Absolutely none. That is the truth, and I can't say more than that.
I'd like to explore the meaning of loss of dignity. Most people won't have experienced the loss of their bodily functions. I wonder if you could give me an example from your experience of a loss of dignity.
Loss of dignity is an enormous issue, but it is quite difficult because it is perceived by different patients in different ways, and so an overall broad sort of precise definition is not easy. But there are all sorts of symptoms I can think of. Severe shortness of breath, choking, inability to speak and get yourself understood, and then the vomiting and diarrhea, which is just awful. But the thing that really troubles people, I think, and surprisingly more than pain and often more than any of these other symptoms, is the double incontinence. And this is particularly, well, it's solely really, if the patient is fully conscious and they just find the mess and the smell and the awfulness of it all beyond what they can bear. And they see themselves descending into a sort of an even worse situation. And they will say, life has nothing, this is not life, this is an existence, and this means nothing to me. And I just want to be out of it. I just cannot bear this any longer.
Some people say that a change in the law will seriously affect the relationship between the doctor and the patient. Mm-hmm. What are your thoughts about that?
Well, I do accept that people do think this, but I would disagree with them. And I think very strongly that a change in the law would increase the trust there is between doctor and patient. I don't think there's any doubt about this. In my own practice, briefly, when I found that when I started talking to patients about the end of life and death and that sort of thing, when I selected a few patients who I thought would be receptive to talking about this sort of thing, I was utterly staggered and amazed by how grateful they were to me.
I find that really interesting that you broached the subject with your patients about death, and that they responded very favourably and wanted to know, because huge numbers of people in surveys are coming out and saying, 80% are saying that they do support assisted dying. But do you think that when they're asked about it, they actually know what they're being asked?
I think people do understand what they're being asked, because unfortunately quite a lot of people have seen a bad death, and the bad death will be different perception for each different patient. But I do think basically they do understand what they're asking for. Yes, I do. I don't think this necessarily means that an awful lot of people are going to be asking for assisted dying, but because I think the evidence is that if they ask for it and know that it's going to be available, they very often never use it.
What sort of problems does the current law on assisted dying create for people?
The present situation causes enormous problems. First, to those relatives who have helped, who are helping people to die. And I don't think any of us can comprehend how awful it must be to be going through the agony of watching your loved one dying and also helping them, and know at the end of it all you're going to be charged with murder. I mean, that is something, I don't think there's anything more one can say. It's just beyond our comprehension how you must feel. Then there's the people who have to travel to Dignitas in Switzerland. There they go to an unknown country, an unknown doctor, and they are usually have to make the request before they need, because they have to do it in order to be fit enough to travel. And I think every patient or every patient's relative who's been questioned when they've come back from Dignitas all say the same thing, that they would have never made the request so soon if they hadn't had to be certain they would be fit enough to travel.
People talk about a good death, and of course it's a very subjective thing, isn't it? And it will differ from opinion to opinion, from person to person. But for you personally, what constitutes a good death?
Well, you're quite right that it is variable and it is subjective, and people do have different views. I accept all that. But for myself, I think I would want first that my symptoms would be well controlled. Second, that my life would not be prolonged. Third, that if I requested it, that I could have assisted dying. Fourth, that I'd come at peace with myself and reconciled any problems or there might have been, and was at one with the world, as you might say. And fifth, very important, that I was able to die at home in my own bed, which I've slept in now for nearly 50 years. And that's what I would like.